think one of the most important things is that people need to know they need to come in. We know women and we know women's health, and we know that we talk to each other as women. That's what we do, but sometimes we're not well served by that. It breaks my heart when people come in and they've really got some significant issues, but they delayed care because the girlfriend, for example, told them that bleeding around menopause was normal, which it necessarily is not. And really, it deserves evaluation. I've seen people really get into tricky circumstances because of that. And so my number one thing is please come in and let us evaluate you. Sometimes there are really important things that need to be done, and it's really important for your health. One of the things that I often address is that you don't have to do what we tell you, which means that you're using your time and energy to get evaluation and management suggestions from people who have years of experience and training, but you don't. Just know that there's options out there. I mean, one option certainly is not to do anything we suggest, but often people say, I didn't want to come in with the bleeding because I was worried you would tell me I needed a hysterectomy. Probably not. Probably there are multiple other options. And if I feel like hysterectomy is the right thing, I'll tell you why. But just remember, you don't have to. You don't have to do anything. It's just so important, though, that you come in and let us evaluate you. Let us give you some suggestions. And certainly let us make sure that nothing dangerous is going on. We find a fair amount of cancer and pre-cancer that we can take care of easily when it's early, but we need people to come in. That is one of the myths that I find it most difficult to address. People say, I didn't want to come in and get a pap smear, for example, because I didn't want to find out I had cancer. Not at all. If you find out that you have changes that might become cancer, we'll fix them. It's not hard to do in most cases. And typically going from normal to cancer is a 10 to 15-year process. We have plenty of time to interrupt. All you have to do is come in for screening.